Hello, and welcome to the Kinky Candy Show. Now here's your host, Miles V.
Good afternoon, good evening, or good night, depending when you're hearing this. My name is Miles V, and welcome to the new official Kinky Candy Show. This show is the late night edition. I'm recording this after midnight. Unlike my other versions of the Kinky Candy Show, or the Birds and the Bees as it was titled previously, this show, this episodes, these late night editions will just be me and you guys just talking a little bit more intimate. Sorry, fellas, if I'm making you guys feel uncomfortable. I promise you, this is not that type of show. But welcome to the new Kinky Candy Show. We've done previous versions of the Kinky Candy Show. As you see, this one has its own intro. This one's the new version of the show. I just wanted to do something a little different because 2020 just been a hell of a year, and we still out here trying to live the lifestyle of the sweet and sexy. So I decided I have to do a little bit more episodes of the Kinky Candy Show and let you guys know you're not alone. So anywho, coronavirus is still around. You would think we have other stuff to worry about during our sex lives, whether it's, the clap, crabs, HIV, AIDS. You can literally go through a list of it. It's just too many to name. So the fact that now we have to worry about COVID-19 in our sex lives, yeah, I'm telling you, it's a thing. It's a thing we have to worry about. The virus isn't over yet. I know, all these restaurants are starting to open up again. All these stores, all the bars, people did in-room dining. So a lot more people are going to start going back out. And I'm pretty sure people have been waiting to fire up that Tinder app or, Bumble or whichever app you're using these days. I have to use plenty of fish. But, people been waiting to come back out. So that now that this in-room dining is open, people are definitely going to start dating again and start going out again. And most likely start hooking up again. So, the NYC Government of Health, Department of Health, the New York City Department of Health, they made this guideline about safer sex and COVID-19. It's crazy that the government feels the need to have to come into our sex lives, but at the same time, COVID-19 is a real thing, so it's better safe than sorry. So I figure it's best to share what's in this guideline with you guys. So it reads, all New Yorkers should stay home as much as possible and minimize contact with others to reduce the spread of COVID-19. And I can tell you right now, here in New York City, people are not staying home. They're going out. It's summertime, it's hot, and they are going out. Everywhere I turn, there's people outside. Definitely way more people than I saw in March. All that stuff they were doing to stay home before is going out the window. Sex is a normal part of life and should always be with consent of all parties. That's a no-brainer right there, but, I guess it's pretty smart for them to add that there. This document offers strategies to reduce the risk of spreading COVID-19 during sex. Decision about sex and sexuality needs to be balanced with personal and public health. During this extended public health emergency, people will and should have sex. Oh, so the part that got me where they said people will and should have sex. The should part. Thanks, government. Thanks for letting me know I should be having sex. I didn't know I should be. I thought I was supposed to wait till marriage, but no. The government says I should be having sex right now. So shout out to NYC Department of Health. Consider using harm reduction strategies to reduce the risks to yourself, your partner, and our community. But can you have sex? Yes. Here are some tips to how to enjoy safer sex and reduce the risk of spreading COVID-19. 1. Know how COVID-19 spread. You can get COVID-19 from a person who has it. The virus spreads through particles in the saliva, mucus of breath of people with COVID-19, even the people who do not have symptoms. See, that's a scary thing, because, it's like, even if you just talk to a person, you could get a little bit of their breath. You know what I'm saying? Especially in the dating scene, you're gonna have to take that face mask off eventually. You can't just go on a blind date and or even not even a blind date, even just a date on Tinder or or somebody you met online. You're gonna want them to take off the mask so you could be assured that's the exact person you was talking to online. How you gonna look on your phone and look at the person they wearing a face mask and you have no clue whether that's them or not? Makeup is a hell of a thing. They could just have a whole different face on and it's not even the person that you were talking to the whole time. You know what I'm saying? You get catfished like crazy with these face masks. I'm just saying. We still have a lot to learn from COVID-19 and sex. The virus has been found in semen and feces, poop. I'm mad they really have feces in parentheses. The virus may have been found in semen and feces, poop, of people with COVID-19. So people who you like doing in the black cherry hole, just know, you can get COVID-19 doing anal. I think that's basically what they're saying, Oral or anal, you can get COVID-19. They just have to say it, where it's, I guess, publicly, where it's not kinky. We do not know if COVID-19 can be spread through vaginal or anal sex. Oh, wait. So let me take that back. Hold on now. So you're saying that it can spread through semen or doo-doo, but you do not know if it can be spread through, vaginal or anal sex. Interesting. We know that other coronaviruses do not easily spread through sex. This means sex is not a likely This means sex is not likely a common way that COVID-19 spreads. 2. Have sex only with people close to you. What? Wow. So I guess I no foreigners, nobody, no foreign exchange students or anything like that. It gotta be people who been around, y'all. They gotta go to the people down the block. You can't just meet somebody who's coming in from town. You can't meet somebody from Chicago and have them fly over here to New York. Now, you gotta be someone close to you. You are your safest sex partner. Masturbation will not spread COVID-19, especially if you wash your hands and any sex toys with soap and water for at least 20 seconds before and after sex. Well, they're not wrong about that. A shameless plug, you can go on KinkyCandyTV.com and shop the store, and we have plenty of masturbation tools and soap and sex toys and, hand sanitizers and, sanitize for your toys, for your hands, everything. Shameless plug. But, you are your safest sex partner. The funny thing, they have the you underlined, like you are your safest sex partner. The next safest partner is someone you live with. Having close contact, including sex, with a small circle of people help prevent COVID-19. Now, if you have a small circle of people you're living with, what kind of real world situation are they? What kind of Big Brother, reality TV show are they setting up right here? Like, just have sex with the people in your circle and you just live the people in your home. Oh no, those colleges with the kids all living together. I'm pretty sure there's no about orgies right now. Like, hey y'all, it says we gotta stay together. Only people that live with us. I'm just saying, until the quarantine's over, until the lockdown is over. I'm just saying, maybe every now and then, we just switch the room. You know what I'm saying? Well, I'm telling you, this is probably going to end up turning a bunch of college kids into swingers. I'm pretty sure of it, if they're not already. Have sex with only consenting partners. Now, that one I feel like is not even for Corona. That's just in general. Life in general, I think you should only have sex with consenting partners. I don't think that's just to prevent coronavirus. I think just for the well-being of men and women everywhere, and the non-binaries. I feel like you should always have sex only with consenting partners. I think so. I'm just saying. And to learn more about consent, visit on the NYC.gov/consent. If you don't know how consent works, or if I really hope you guys do know how the consent works, but just in case, go check it out. You should limit close contact, including sex, with anyone outside your household. If you do have sex with others outside of your household, have as few partners as possible and pick partners you trust. Talk about COVID-19 risk factor just as you would discuss about PrEP, condoms, and other safe sex topics. Ask them about COVID-19 before you hook up. Yeah, and it's already interesting that, we have to go about ways to find out if people, got an STD or anything, not to STD shame anybody, and it's now interesting that we have to add COVID-19 on. They're like, hey, you look great tonight. I've been thinking about you. I couldn't wait. Just, spend some time alone together. And, before we get in any more intimate, I just got to know, have you been tested for COVID-19? I mean, it's like, geez. Oh, man, life is funny, man. Life is funny. Do they have symptoms, or have they had symptoms in the last 14 days? Most people with COVID-19 have symptoms, but asthmatic spread is possible. Fever, cough, sore throat, or shortness of breath are symptoms to ask about. Note that asking about symptoms is not a perfect way to know whether someone has COVID-19. That's going to be really hard to be at a date and you got your face mask off and you try not to cough because you're hot. It's hot, it's 90 degrees outside. You got the face mask in your face and you're just breathing a hot air in your face. Now you coughing and now your day's wondering if you got corona or not. It's not going to be easy out there, guys. I know you guys know that now. It's not going to be easy. Have they been diagnosed with COVID-19 using nasal swab or saliva test? People who have recovered for COVID-19 at least 10 days from the day their symptoms started and who have not had fever for the last 3 days are likely no longer infectious. If 2 is company, then 3 or more is definitely a crowd. Large gatherings of any type are not safe during COVID-19. Close contact with multiple people should be avoided. But if you decide to find a crowd, below are tips to reduce your risk of spreading or getting COVID-19. I think this is code word for it. You're gonna have an orgy, follow these guidelines. Limit the size of your guest list. Let's rephrase that. Limit the size of your orgy. Keep it intimate. Go with a consistent sex partner. Pick larger, more open, well-ventilated space. Wear a face covering, avoid kissing, and do not touch your eyes, nose, mouth with unwashed hands. And bring an alcohol-based hand sanitizer. Wow, I think that's the most accurate thing to do if you're gonna go to an orgy. I gotta agree with the government here. The government knows how to deal with going to an orgy. The government knows this is how you go to an orgy. If you usually meet your sex partner online or make a living by having sex, consider taking a break from in-person dates. Wow. Okay, let's be serious. Video dates, sexting, subscription-based fan platforms, sexy Zoom parties, or chat rooms may be an option for you. Yo, shout out to the government, man. They know, they keep it real. They keep it real. Like, hey, man, get your money, ladies. Get your money, men. Ain't no shame in the game. Ain't no shame. If you decide to have sex outside of your circle of contacts or hook up, closely monitor yourself for symptoms. Consider getting a swab or saliva test for COVID-19 on a more frequent basis, monthly or within 5 to 7 days of a hookup. Jeez, Louise, I gotta admit, y'all, I might be able to take a break from talking to people just so I can survive COVID-19, because that's just insane. If every date you go on, every 5 to 7 days, you gotta go get a checkup because you decided you wanted to go to brunch with the random girl you met on Tinder or whatever. There's so many I can't even think of it anymore. Testing is free at sites sponsored by NYC Health and Hospitals. Take precaution in interacting with people at risk for severe COVID-19 illness, such as people over the age of 65 or people with serious medical conditions. Be vigilant with face coverings and healthy hand hygiene to minimize the risk to others. Having antibodies against the virus that cause COVID-19 or prior positive diagnostic tests do not mean definite immunity. Use test results with caution in helping you make decisions about sex. 4. Take care during sex. Start playing that Drake, y'all. Start tell Siri to play Drake. Or Alexa, or whatever device you guys have. Kissing can easily pass the virus. Avoid kissing anyone who is not part of your small circle or close contact. Jeez, this is just taking all the intimacy out of sex. Rimming, mouth on the anus, might spread the virus. Yeah. The fact that they have in parentheses under rimming, mouth on anus, it just took me out, I'm sorry. Might spread the virus. Virus in the feces may enter your mouth and lead to an infection. You know what's funny? So the other day, I'm not going to say no names, but I was actually in a conversation with my homegirl and her man. I forgot what the conversation was. I think maybe it was about a song, and the song was talking about eating booty like groceries, and I'm just like, I forgot what it was, but I was just like, basically they were like, well, everybody eats booty like groceries. I'm like, I've never eaten booty a day in my life. And she just go, oh. And she it was just like, she couldn't, agree with that one. She definitely eating booty. The both of them looked away, could have said nothing to me, and I'm just like, hey, eating booty is definitely something you gotta do with someone personal that you hooked up with. That's gotta be your man, that gotta be your woman. You just can't be just eating groceries all willy-nilly. One thing for sure, I'm not smoking with them after they have sex ever again. That's not happening. I think COVID-19 has taught me it's time to start doing facials. I can't smoke with people no more. That's just people out here eating groceries. Anyways, wear a face mask, cover your face with a mask. Maybe it's your thing, maybe it's not, but COVID-19, wearing a face mask covers your nose and mouth is a good way to add a layer of protection during sex. Heavy breathing and panting can spread the virus further, and if you and your partner have COVID-19 and don't know it, a mask can help stop the spread. Whew, I'm telling you, sex already gets hot as it is. So you want to add a mask on top of that? It's just like, oh Lord, babe, we're not going out the house. We're not ever leaving the house. That's insane. To wear a face mask during sex nah. We living together. We staying in quarantine. We're ordering out. We're ordering everything. We're not going out. That's crazy. Make it a little kinky. Be creative with your sexual position and physical barriers, like walls that allow sexual contact while preventing close face-to-face contact. So, is the government saying we need some glory holes out here? Like, this sounds like a glory hole situation. If they're talking about a hole, a wall and physical barriers, Masturbate together. Wow. Yep, that's what it says. Masturbate together. Use physical distance and face coverings to reduce the risk. Condoms and dental dams can reduce contact with saliva, semen, or feces during oral or anal sex. You can find all those on KinkyCandyTV.com. Link in the description. Washing up before and after sex is more important than ever. Wash hands with soap and water for at least 20 seconds. Wash sex toys and soap and with warm water. Disinfect keyboards and touchscreens that you share with others. Like I told you guys before, we have all those type of products on Kinky Candy if you need it. Now, it says number 5, skip sex if you or your partner are not feeling well. If you feel unwell or even start to feel unwell, avoid kissing, sex, or any close contact with others. If you have been exposed to someone with COVID-19, avoid close contact with anyone outside your household and follow NYC guidelines on how to prevent exposing others. If you or your partner have a medical condition that can lead to severe COVID-19 illness, you may also want to skip sex. Medical conditions include lung disease, moderate to severe asthma, heart disease, diabetes, obesity, kidney disease, liver disease, cancer, a weakened immune system. For example, having unsuppressed HIV or low CD4 count. See, I told you this episode was not going to be sexy. Prevent HIV or other sexually transmitted STIs and untended pregnancies. Yeah, and then it goes into a list of, everything. Just go back to nyc.gov/health for, getting condoms, getting, visiting the sexual health clinics here in New York, and, how to deal with pregnancies. And for more information, visit nyc.gov/health/coronavirus or cdc.gov/COVID-19. Whoa. My people, my beautiful people. It's hard. It's hard out here. I'm sure everybody on lockdown is just, if you don't have a small circle, if you don't have a small circle to, get your kinks out, you definitely trying to have your hot girl summer. Megan Thee Stallion just dropped her Girls on the Hood track, and you trying to get out there and get, you trying to do your thing, and fellas, you trying to soak your royal oats. I get it. It's summertime. It's hot. It's that time of year. 4th of July weekend just passed. But you got to be careful, guys. It's not a game out here. COVID-19 is a real thing, and I know we joke around, we kid around, but at the same time, we gotta be serious. Sex have not always been dangerous. I'm pretty much sure there was a time we could have sex and they didn't have to worry about anything. But I don't know about anything. But anywho, we have to be cautious because. Unlike an AIDS or herpes or HIV, coronavirus can just, you can have sex with somebody with coronavirus and then go home and talk to your family, and now your family got coronavirus. You know what I mean? Can you imagine if you get AIDS and then you go home and you give your whole family AIDS? That would be fucking insane. Everybody would just fucking hate you. You know what I mean? Not to shame anybody who got AIDS. I'm just saying. So you got to be careful, people, because we don't need to spread the virus, and it's everybody's having spikes all over the place, so we got to be on our P's and Q's. So be careful out there. Until next time, this is the Kinky Candy Show. I am Miles V. I'll see you soon.
For more love, sex, and relationship content, follow Kinky Candy TV.